Hi guys, my name is Tiffany and welcome back to another episode of Tiny Tips with Tiff, where basically I teach you guys how to do skills in the NICU. So I've done a few episodes so far, and this one I thought I would share with you guys how to insert an IV. So with babies, it can be a little bit complicated just because they're so small, but something I want to share with you guys is that IV skills is something that may take some time. And personally, I don't insert that many IVs and I'm still working on my skills, and it takes a lot of practice. And so you really have to be able to put yourself out there and take every opportunity. If someone is needing an IV, ask them, hey, can I help you, or can I insert it? And so it's something that takes a lot of practice and time with, especially as a new grad. And so I just tried to make the most out of my experience, and if anyone needed one, I put myself out there and asked if they needed help. And don't be afraid. Maybe with the first one, if you want to watch someone do it, then definitely do that. That way you can see how their skills are. And then with the next few, please try your best to put yourself out there and do them. Don't be afraid to not, because that's going to really hinder you from getting better with your skills. So put yourself out there when it comes to learning how to do IVs. But it does take a lot of practice, and even now with 4 years of experience, I still need to work on my IV skills. So don't worry about it if you don't get it the first time. And what happens is that when it comes to IVs, you always need someone there with you as a support system, especially when it comes to holding your baby or getting the supplies you need. IVs is typically not a one-person process, so always make sure to ask someone there to help you out. So yeah, I thought I would share with you guys on how to insert an IV on a baby, and hopefully this video is helpful to you. And if there's any other skills you would like me to teach you guys on what to do in the NICU, please let me know down in the comments below, and hopefully I can do more episodes on this, and hopefully these videos are helpful to you. So stay tuned. Here is my mannequin, and these are some of the supplies that you will need for your IV. So you'll usually need your connector here, and then this is some gauze, some alcohol prep. Some people use ChlorPrep, so look at the hospital policy for your hospital. And this is a Tegaderm that we use for IVs. We call it the Baby Bear IV Advanced Tegaderm. So it has little teddy bears on it. Of course, you're gonna need your heel warmer. You're going to need a normal saline syringe, and then your IVs. So I typically like to grab 2 just in case I don't get my first one. And so these are usually the supplies that you'll need. So first things first, I'm going to prep all my IV materials. So I'm gonna just open everything. Of course, wear your gloves on, but for this circumstance, I don't have any gloves, so make sure to wear your gloves. But I like to open my normal saline flush first, and then with my connector, I like to make sure to prime it. So I'll open my cap, push out any air. So I'll push out the air, and then I'll attach it to my connector and flush it. So I like to put it in here so that my flush isn't going everywhere, and then I flush my line. And then I kind of like stick it back in with my flush ready to go, and I leave it at the side. So next thing is, of course, I open my IV. And this is a 24 gauge one. This is typically the one we use in the NICU. It's like the smallest size. So I like to open it and have it ready to go. And I like to loosen the cap a little bit too, but make sure to not take it all the way out, because you want to keep it as sterile as possible, and you don't want to accidentally poke yourself either. So I kind of like to loosen it, and then I'll leave it capped. Of course, your gauze, your alcohol prep. And I like to leave it on top of my packaging so it's all nice and clean. And then your heel warmer. And then of course your teddy bear. So this is a teddy bear. It has little teddy bears on it. And this is what we use to cover IV. So of course you want to make sure to wrap your baby. So I'm going to wrap my baby. So I don't have a proper swaddle for my baby, but I like to keep them wrapped. That way they're not flinging their arms around. You need a second person to help you, because you want to make sure that you get your IV. So have someone next to you. That way they can hold the baby and keep a pacifier in the baby's mouth, and that way the baby is soothed. And of course, use sucrose when you're doing IVs, because it is a painful procedure, and that's something that we use to help soothe our babies. So I typically like to go for extremities that are closer to me, and that's way it's easier. Always reposition your baby in a way that's comfortable for you. So if my baby's arm is down like this, then I want to make sure it's perpendicular to me. So it is easier for me to grip my baby's arm and hold. But for the sake of this, I'm going to take the swaddle out so you guys can see how I'm positioning and holding my baby. So make sure to swaddle your baby so your baby isn't like flailing around everywhere, but I just want to share with you guys that we can see properly how I do it. So let's say I'm going to do the IV and I'll do it on this hand for the sake of demonstration so you guys can actually see better. But typically I like to do extremities that are closer to me, but whichever vein that you can see is the one you're going to go for. So your hospital hopefully has like a viewfinder, and that way you can view your veins. But usually I like to grip my baby's arm and make sure that it's easy for me to hold. So I forgot to mention, as part of my supplies, we like to use rubber bands in the NICU, and this is just something that's super interesting, but we literally will cut a rubber band in half and then we'll use it as our tourniquet. So when it comes to tying it, I like to make sure to put my finger underneath, and I kind of tie a loop that is easy for me to pull out. So I always have like a string that's loosely, that I can just snap off my baby. So with the tourniquet, this is usually what we do. Make a little loop, and that way it's easy for me to slip it off. And then I'll hold my baby's arm as comfortably as I can, so that way I can grip it easily, because usually your baby will fight you. So you want to make sure to hold the arm as very firmly as you possibly can. Now I usually have my IV catheter next to me. If you need to, you can also put a heel warmer. So typically I like to put a heel warmer and put it on for 15 minutes at least to get the blood flowing. You don't really have to as much as you need it with labs. But with IVs, I like to do it just because it just gets the blood flowing. So let's say I put the heel warmer on for 15 minutes. I have my IV catheter with me. So of course the first thing you need is your alcohol swab. And make sure to alcohol swab your baby and let that dry. So let's say this is my baby's vein. Hopefully you guys can see that. Let's say this is my baby's vein. So I wanna make sure that the vein is pointing towards me, and that way I'm not awkwardly having to move my body in a weird angle, and make sure that it's in an appropriate position for me, that I'm comfortable. So if I have to reposition my baby, I will. So I'm gonna go for the one that's pointing at me. So this one right here, that's pointing at me. I have my IV catheter, and kind of let the cap fall off. And like I said, make sure you don't click on this. I like to hold it right here, where it's kind of where your fingers get placed, like that. And then you want to kind of go in at a slight angle, not all the way, not a 90 degree. You don't want to go in like this, you don't want to go like this. You want to go very superficially. And I like to follow where the end of my vein is at. So I'll start from there, kind of go in at an angle, so I'll poke in, and then I will lower my needle and then push it in further. Okay, so for demonstration purposes, hopefully you guys can see this, but typically what I like to do is I go in at a slight angle. Once I get past the skin, then I'll lower it and go in further. So remember, always go in at a slight angle, and then once you get in, you lower your needle down. Hopefully that makes sense. So I'll go in at a little bit of an angle, then I will lower my needle and kind of thread it through until I get blood return. Once I get blood return, then I stop and I just push my catheter only. So I'll only push the yellow tip and push it in until I get it where it's supposed to be. And so let's say that my needle is in, or that let's say I have my hub where it needs to be, then I'll retract my needle. Of course, it's not gonna stay in my mannequin. So let's say it's in there like that, right? Always make sure to flush it and make sure that it's where it needs to be. So let's say it's in there, right? So I'm gonna attach the end of my extension in there, flush my IV, make sure to have a finger on top of your catheter hub or it's going to plop off. So I like to hold my finger on there, and that way I can flush, and let's say it flushes beautifully. So of course now we want to tape it, right? So typically I always have my hand on the yellow hub, make sure it doesn't come off. So with the teddy bear, I peel off with one hand. So I have my teddy bear like this. And usually you want the little V, do you see the V underneath the tape? You want that going towards your extension. It's so hard to do this on a mannequin, but it's usually going to look like this. Okay. So it's gonna look something like that. You want the tape underneath your hub, so make sure to kind of go underneath and seal it. And then you can peel it off. So it's gonna look like that. And then you have 3 stickers left on here. So typically we grab the big teddy bear and we put that over the yellow hub. Like that. Looks like that. And then there's still 2 stickers on here. So then what we usually do is we grab the other one without the writing on it. We grab this one and we like to chevron it. So we put it underneath like that and kind of fold it over like that. So it looks like this. And then with the last piece, there's one more piece on here. We grab the rest of the extension and we kind of put it upward. And then we tape over it like this. So that way your extension, you give some leeway and then it's kind of connected to the patient. So that's typically what it should look like. And then usually you can take your flush off, obviously, and then you can cap it if you have a cap, or if you need to give medication through it, then you can give medication, but you want to make sure that this is capped if you're not using it. So that's kind of what it looks like. Hopefully that helps you guys out. I know it's not as easy as it seems on a mannequin, of course, but I wanted to share with you guys some of my techniques. So hopefully that was helpful. So hopefully this video is helpful to you guys and that you were able to learn something out of this. And remember that this is always a practice and ongoing thing. So make sure to put yourself out there and get every opportunity that you can to learn how to do IVs. So I will see you guys in my next video. Bye. 'Cause anywhere you feels right, anywhere you feels like Paris in the train, Paris in the train.